We at Igenomix provide the best and the most advanced genetic services to doctors and to patients. We are focusing the reproductive field of genetics. We started 18 years ago in Spain in a very small lab, starting to deal with genetics, with understanding the DNA, dealing with the chromosomes, genetic disorder, genetic mutations.
Igenomix is a company that provides advanced genetic services in reproductive medicine. Major customers for Igenomix Middle East is IVF clinic, where in IVF clinic, eggs are retrieved from the mother and sperm from the father, and then fertilization occur. The day of the fertilization is day 1 and Igenomix Middle East receive the sample at day 3. Once we receive the sample at day 3, we do the experiment according to the different protocol. For example, day 3 sample can be used to do the analysis for chromosomal screening, that is PGS, and also for single gene disorder, that is PGD.
Igenomix has presence in more than 50 countries and we have more than 12 laboratories currently. We have laboratories in North America, we have laboratories in Latin America, we have in Europe. Our main laboratory and the headquarters is based and is located in Valencia. We have presence in Asia and we have presence in Middle East. Currently we have one laboratory in Dubai and we are scheduling and setting up 2 new laboratories in Kuwait and in Saudi Arabia. For Igenomix, quality and technology is really important. It's one of the key most important points in our mission and vision of the company for the future. In 2016, Igenomix Middle East, the laboratory in Dubai, was accredited by CAP, College of American Pathologists. We got this accreditation that certified that this laboratory is following the most precise quality guidelines and regulation related to a genetic laboratory. We were the first laboratory in the whole Middle East getting this accreditation.
The basis of our product lie in research and development, overseen by Dr. Carlos Simon, that enable us to create and develop specific tool to support professional in the reproductive medicine field. Igenomix invests 15% of its total profit every year in R&D to provide best and latest services. Access to the laboratory is only for the laboratory directors and technicians. Automated softwares are used for releasing all the reports. All the reports are double-checked with our experts in Spain and then released to our customers.
We know that the consanguinity rate in the Middle East countries is very high, ranging from 30 to 40%. This is the cause of an increased risk of having a genetic disorder in a family. The second main area where we can help the Arab population is in the fertility and reproductive field. We know that fertility is considered the third main issue worldwide, and we have the latest technology and the latest genetic services to help the population. We know that at the age of 35, 36, the ladies has a rate of abnormal embryos ranging around 70 to 80%. So it's mandatory to screen the embryos and to exactly know which is the best embryo to transfer to get the pregnancy. Igenomix Middle East have 3 categories of genetic services: preconception, preimplantation, and prenatal. In the preconception category, Igenomix has 3 genetic services. The first genetic service is called whole exome sequencing, where we are amplifying and getting the DNA of individual and analyzing more than 20,000 genes. The second is called CGT, carrier genetic test, where we are screening the possibility for a couple to have an affected child, carrying one single mutation or more than one single mutation in common. We are screening around 6,000 gene mutations. And the last one is called oncodona. We want to rule out the possibility for an individual, for a lady, to develop breast or ovarian cancer in the future. In the preimplantation category, Igenomix has 3 genetic services: PGS, PGD, and ERA. PGS is preimplantation genetic screening. What we want to do here is screen the embryos and then rule out any chromosomal abnormality embryo. In the PGD is preimplantation genetic disorder. We want to rule out the embryo to have any single gene disorder and then choose the best one to transfer to the uterus of the woman. The last one is ERA, endometrial receptivity analysis, where we want to identify the best day for the embryo to be transferred into the uterus of the woman. In the prenatal category, we have two genetic services. One is called NACE. It's an NAPT, it's a non-invasive prenatal test where we are taking the blood of the mother and ruling out any possibility of chromosomal abnormalities of the fetus. We are understanding the fetus through the blood of the mother. The last one is product of conception, POC. We want to identify the cause of a miscarriage in a woman. Then we are taking the miscarriage tissue and identify any abnormality, chromosomal abnormality in the tissue.
Every life matters to us. At Igenomix, we do our best to ensure a successful pregnancy and health of your baby. We are your partners in reproductive success.